Rajesh, can you confirm the slides?
Yes, Shailaja.
They are in slideshow mode, right,
Right.
Rajesh?
Yes. Yes, Shailaja.
Ye- Yeah, thank you, Rajesh. Yeah.
Thank you.
So once again, good afternoon, guys. So I think, shall we wait for another couple of minutes? Of- Yeah. Meantime, maybe. Uh, so meantime, just before we start it, I'll just like to know. So people from KVC campus, they are all attending from the conference room? Anyone can just let us know. Interns from KVC campus, please respond.
Yes, ma'am.
If you have a mind. Okay. So you all are sitting in the conference room and attending? Okay. What about interns from GMRV campus and MTC campus?
Yes, ma'am.
Yeah, we are also
Yeah.
from MPC campus.
Okay. So I can see MTC auditorium and GMRV classroom, I can see. What about KVC?
We all join from our phones only, ma'am.
Okay, you all joined through. So you are you are out of the preclinical labs, right?
Pardon me, we are not able to hear.
Is it audible now?
Yes, it's audible.
No, I'm just asking. You are now out of the preclinical labs. I'm asking. So you are back to your
No, we are in
hostels?
the lab. We are not in the hostel. We are in the lab.
Okay, but you are connected through your mobiles.
Yeah.
Ma'am.
Yeah, sure. Maybe before I just start, I would like to know. I would like to have a quick feedback from the other campuses, MTC, GMRV, and KVC campus. So how is it your preclinical training going on? So if there is any, just quick feedback, because it's been 2 weeks, right? You started with your preclinical training. So I just wanted to know whether you have any concerns or anything. I just wanted to hear from you. How is it happening? Maybe first from MTC campus? MTC? Others, please mute your mics. Let's only hear from MTC campus.
Yeah, we are talking from the MPC campus, and training has been.
Okay. Your voice is not stable. There is a continuous break in the voice. Hello. Is it problem with my internet connectivity, or is it hello?
Yes. Can you hear us? Hello.
Yes, we can hear you. Now you can go ahead.
Yes, ma'am. So our training has been going on pretty well. We are from the
Okay.
campus, and so far it has been.
Okay. Okay. So it's going on as per the schedules, right?
Yes.
And you are getting you all got your logbooks?
Yes, ma'am.
Okay. So you just started, you would have finished 2 weeks of your training. So maybe by this time you would have finished, except subjective and the tonometry, all the techniques would have started for you, right?
Yes, the rest have been started and we are
Good.
going.
Yes. Anything, any concern do you have? Anything you feel that it needs to be improved or any concern you would like to share?
Hello? Am I audible?
Yes, yes.
No, we don't have.
You are
any.
audible, but you don't have anything. Okay, good. Okay, but if any issues you want to bring it, like anything you feel that it needs to be improved, so you can write anytime an email to us so that we can sit and we can decide what best we can do that. Okay. What about GMRV campus and KVC campus? How is it going on? GMRV?
It's good, Shaileja.
It's good. Okay.
Yeah.
So all the instruments are ready to handle for you?
Yes.
Yes. Okay. What about KVC campus?
Everything is going well, ma'am. Till now, we all get lot of opportunities to do retinoscopy, lensometries, visual acuity, as well as every day our consultant optometrists give us lot of clinical histories. So we are doing all the things every day in groups.
Good. Good. I think only the change which happens, I think from my end, okay. Only the thing what happens is that few of the techniques will continue for another 2 weeks. In place of visual acuity, you will start subject to refraction from Monday onwards. And in place of slit lamp examination, you will start applanation tonometry. But the remaining techniques like history, lensometer, objective refraction will remain continuing for the next 2 weeks. Okay. Am I, hello? Okay. Coming to the BLSO campus. Anything you would like to share? BLSO, CAR campus, Hyderabad campus.
I'm all good, ma'am. All fine.
All good?
Yes, ma'am.
Hello. Okay.
Yes, ma'am.
So one thing I just wanted to
Yes, ma'am, all
again
good.
okay. Okay. So one thing I just wanted to tell you again is that take serious on the logbooks. Okay, so just try to, it's not about the quantity, the numbers you are filling in the logbooks, it's about the quality. So make sure that whatever you have done, that only should enter into the logbook. In a hurry to complete the logbooks, just don't copy the numbers from your friends and don't complete the number of techniques. Okay, if you can't able to complete the number of techniques, it's okay. But whatever you have practiced, only just complete into the logbooks. Okay. And like I said, these logbooks will definitely will help in the future. If you want to submit to your colleges or anything, like how many refractions have you done or how many subjective tonometries have you done. So definitely these logbooks will be helpful to you. So take more serious on when you are when you are filling the logbooks. Okay. And another update is that tentatively the exit competency exam is planned on 1st, 2nd, 3rd and 4th August. So for some of the campuses, you may finish it in 2 days. Some of the campus may go for 3 days, and the BLSO campus, it is planned for 5 days. So, but tentatively, the exit competency exam will be having on 1st week of August. Okay, so you have another 2 weeks to go. So make sure don't waste your time. Even if you feel that you have got the technique, but still practice it until you become confident in doing that technique. Okay. So maybe sometime in the last week of July, I'll take you another session on how the exam would be there. So what all the components we are going to assess, how are we going to assess? So I'll give you a detailed information about the examination pattern. Okay, sometime in the last week of July, just before the exams, I'll prepare you for the examination pattern. Is that okay?
Okay.
Okay. Yeah. Yes. So coming to anything before I started, anything anyone wants to talk, or shall I start the session? Silence. Okay. Good. So from Monday, like I said, we are going to start with the subjective refraction techniques. So what I thought is, let's have a common discussion on the subjective refraction, and then maybe it will be easy for you to start your practicals when you do it on from next week. Okay, so usually most of the times what happens is that we more depend on the objective refraction compared to the subjective acceptance. Okay, so what happens is either you do it a retinoscope or autorefractor. So with whatever the values, refraction values, whatever you got it. So in most of the clinics, what we tend to do is we directly go ahead and prescribe the objective refraction values or the autoref values, whatever we got it as a final spectacle prescription. Okay, but so usually what happens is that that may not be the correct prescription for the patient. Okay, so measurement of refractive error, when we talk about that, it's not just only objective refraction techniques. It is also important that immediately after getting your objective refraction values, we need to perform the subjective refraction. Okay, and the subjective refraction also happens in two steps: monocular and the binocular assessment. We need to have the monocular endpoints and then binocularly balance it, and then we have to give the final spectacle prescription. So why is it when you have the objective refraction, you can ask me, why is it important to do the subjective refraction? When you already have the objective refraction values, why do you want to do the subjective refraction? The reason why is that, so even the literature or the practically also, it has been established that the measurement uncertainty, okay, the measurement uncertainty when you do the different ways in different ways, okay, that is either it can be intra-observer, inter-observer, okay, the error in the measurement is lower for the subjective refraction as compared to the objective refraction or autoref. It is only less, it is just less than 0.5 diopters, whereas when you talk about the objective refraction or autoref, it is more than plus or minus 0.75 diopters. Okay, so the measurement error is lower for subjective refraction, and also the neutrality point when you talk about the objective refraction, not everyone is confident in getting the neutrality point. Most of the time what happens is we depend on the point of reversal, right? So what happens is that most of the time we may miss the neutrality point, and then once there is a point of reversal, we take that as the end point. In that in that whatever the change, whatever you have done from the this neutrality to the point of reversal, again there are chances that there may be a measurement error. And also it is also reported in the literature that if while you're doing the objective refraction using a retinoscope, okay, if the retinoscope is reflected from the internal limiting membrane, that is of the 10 layers of the retina, once you throw the light, if the retinoscope light is what is reflected back from the internal limiting membrane, then the eye is falsely estimated to be more hyperopic. Whereas if the retinoscope light is reflected from the choroid, okay, so then the light is what is falsely estimated to be myopic. So this also contribute to the error in the measurement. So that's the reason it is always important that you have to perform a subjective refraction before you go ahead and you give the final spectacle prescription. Never ever directly go and with your objective values as a final spectacle prescriptions. Okay, so what is this subjective refraction? Okay, so what we do in the subjective refraction is that we compare one lens against the other, that whatever the values we got it in the objective refraction, we compare one lens to the other, and we end up getting a best combination of the corrective lenses that gives us the maximum visual acuity. And the name itself tells us that it is a subjective. So it's the patient response. So we are taking the response from the patient, whichever the lenses the patient feels they are giving the best visual acuity, that is the maximum visual acuity. So that is what is we are prescribing as a final spectacle. Judgment has to be given by the patient. So whatever the lenses we give, the combination of lenses, that should be comfortable to the patient. So that process is what is we do it in while we are doing the subjective refraction. Okay, so like I said, subjective refraction is not just a one-step procedure. We do have a multiple steps where we do monocularly first, and then we go ahead and do the binocular, and then we give the final spectacle prescription. And while we are doing the monocular procedure also, we do have again different steps. Okay, first step is what is we check for the sphere. Okay, we do check for the first vision, best vision sphere. Okay, so usually the best vision sphere is what is done by the maximum plus maximum visual acuity test. That is what is we call it as a fogging procedure. Okay, once we establish the best vision sphere, then we check for the cylindrical component. That is we verify the cylinder axis and power. That again we do it in the two tests. One is the astigmatic fan, okay, where we can able to get roughly estimate what is the axis and the power. While you want to refine the axis and the power, we use the Jackson's cross cylinder. One is for the estimation of the axis and power, other is for the refinement of the axis and power. Once we got the best vision sphere, the axis and the power, then again we recheck the sphere power. We refine the sphere power. Okay, that refinement of the sphere power usually we does using the duochrome test. Okay, so that duochrome test what is helps us in identifying if there are any small errors in the prescription. The same thing we repeat it for the other eye. So once we have done these steps for the right eye, we go ahead and we repeat for the left eye. While we are doing for the right eye, the left eye is being occluded. Same thing we do. While we are doing for the left eye, the right eye will be occluded. Once we establish our monocular values, then we go ahead and we do the binocular balancing test. The purpose of this binocular balancing test is to make sure that the accommodation is balanced in both the eyes. Once this step is done, then we write the final spectacle prescription. Okay, so this is what is exactly happens in the subjective refraction. It's not just one-step procedure. You have to follow the multiple steps, and then you end up giving the best correction for the patient. So am I clear with until now? If you have any questions, you can just write it in the chat box immediately, or we can have the question and answer session at the end. But if you still have a question in between, if you want to ask, you can just write it in the chat box. Okay. Yeah. So now what we will do it is next 1 hour of our time, we will just go ahead one by one step, and then we will see how we go ahead and do the subjective refraction. Okay. The first step is what is the first vision sphere. Then we have the cylindrical check axis and power. Then we have a first sphere refinement, then the binocular balancing. These are the 4 steps which are required if you got a spherocylindrical prescription. But if you have only the spherical prescription, need not go ahead and do the second step. Directly, you can start with the first sphere check. You can refine the sphere. You can do the binocular balancing and then go ahead and give the final spectacle prescription. But the error what you got it in the objective refraction, if it is a spherocylindrical error, then you have to do the 4 steps. Check the sphere, refine the axis and power of the cylinder, refine the sphere, and then do the binocular balancing, then give the spectacle prescription. Okay. So now the first one is, what is the first sphere check? Like I said, the purpose of the first sphere check is to minimize the accommodation response. Okay, in a way, this is what is the technique what we call as the non-cycloplegic control of the accommodation. Okay, so the technique what we use for this is what we call it as the fogging or maximum plus maximum visual acuity test. Okay, so what exactly happens here is that without using any cycloplegic eye drops, we are controlling the accommodation of the eye, and then we are getting the best vision for the patient. Okay, so like I said, the whole purpose of why we do this test is what? To control the accommodation, to minimize, and then we finally get the best vision. So I'm keep on saying that we control the accommodation, we minimize the accommodation. How are you going to do that when you are doing the test? Is that we purposefully over plus the spherical power, we give in more plus in front of the eye. What happens when we give more plus in front of the eye? It accommodation is what is relaxed, right? Plus lenses relaxes the accommodation and minus lenses stimulates the accommodation. The moment you give more plus in front of the eye, it automatically starts relaxing the accommodation. Then what we does it is slowly we'll reduce the sphere power in a step 0.25 diopter steps, and then we end up having the best sphere. That's how we do the fogging technique. Okay, so before I say the procedure, so like I said, what happens if you don't relax the accommodation? Can anyone write it in the chat box? I'm keep on saying accommodation need to be relaxed. Why is it important to relax the accommodation? What happens if the accommodation is not relaxed? Any quick answers in the chat box?
We can't able to give the correct prescription.
Okay. Okay, good. In a way, good attempt. Any other answers?
If the accommodation is relaxed, then the lens is not focus the image on retina.
If the accommodation is not relaxed, okay. Yes, it's almost the same. So what happens is that if we talk about in terms of spectacle prescription, while you are doing a subjective refraction, I think there are overcorrection, false value in retinoscopy, correct, errors may come, right? And even the patient may become symptomatic. So in terms of correction, if you don't relax the accommodation, so usually when you are correcting a myopic eye, it results in the overcorrection of the myopia. And if it is when you are doing a hyperopic correction, it results as a undercorrection of the hyperopia, which exactly, if you undercorrect a hyperop, again you are stimulating the accommodation. If you are overcorrecting the hyperop, again you stimulate an accommodation. That results in the patient not comfortable with the patient spectacles. That's the reason. So the most important thing what needs to be done in the subjective refraction is that you completely control the accommodation. Though while you are doing the objective refraction, you give a far distant target to relax their accommodation, but still there is a chances for the measurement uncertainty because of the multiple reasons. That all needs to be controlled while you are doing in the subjective refraction. Always make sure that you relax the accommodation. Either you are doing a monocular technique or you are doing a binocular technique. Okay. And how do you relax the accommodation? Okay. So how do you relax the, before that? So the impact of fogging is that when the eye is fogged with the plus lenses, when the eye is fogged with the plus lenses, the use of accommodation is discouraged. Patient cannot able to use their accommodation and make the image clear. So that's what is the fogging helps us. So the technique what we do is, that's the reason it is called as fogging. Actually, we not only do the fog, we do the defog also. It has to be fogging and defogging technique, but most commonly we use only the terminology what we use is the fogging technique. Actually, the terminology should be maximum plus maximum visual acuity. Okay, but commonly in what we most of the times what we use that name as the fogging technique. It's so the reason why we call fog and why you use plus lenses to fog is because of the using the plus lenses, the accommodation is discouraged. Use of accommodation is so we are getting the true power what is required for the patient. And how much is the plus power required to fog? How much is the plus power required to fog? So usually to the net objective refraction value, we add plus 1.5 diopters or plus 2 diopters. If your if your working distance lens is 1.5, add more 1.5 to the net objective value. If your working distance lens is plus 2 diopters, add more, plus 2 diopters to the your net objective refraction. Yeah, someone has raised a hand in between. Is it someone? It's yes.
Yeah, ma'am. One question. Ma'am, the net value we have to plus add, no? Add.
I didn't get you. Can you just repeat it again?
Ma'am, the net value that I
yes. To the net value, you have to add. Indirectly, when you add to the net value, it becomes your gross value only.
Gross value, okay.
Yes, it becomes your gross value only. So either you add, some people are comfortable doing only getting as a net value. So if I have to make the statement in other way, start with fogging technique with your gross value. That is also another way we can do. Okay, example is what is I have written. If your net objective refraction value is plus 3 diopters, your starting lens for the fogging technique will be plus 4.5 diopters if my working distance is 66 centimeters. That is nothing but your gross value only. If your net objective refraction value is minus 3, I'll add plus 1.5 diopters to minus 3. Then the resultant will become minus 1.5 diopters, which is again my gross value and starting lens for the fogging technique. Did I made it clear, everyone?
Yes.
Yes, ma'am.
Yeah.
Yes.
And another one important thing what you have to keep it in mind is not necessary that always you need to restrict only with plus 1.5 diopters or plus 2 diopters. Sometimes you may go beyond this power also, because when you feel that the patient is having more cannot able to relax their accommodation, and when you feel that more plus power is required to relax their accommodation, still you can give more, you can fog with more plus. Okay, it's not that though I said plus 1.5 diopters or plus 2 diopters, not necessary that only these two powers you have to use. You can use more than this also as your fogging power. When the patient is having more accommodation and not able to relax, you can give plus 3 also as a power, or plus 4 also you can give as the fog power. Okay. Someone has asked, can you repeat it again for minus? So for either it is a plus power or it is a minus power, you need to add plus 1.5 diopters to your net objective value. Okay. For example, when it is plus 3, okay, and my working distance is 66 centimeter. So I'll add plus 1.5. So plus 3 plus 1.5. The starting lens for fogging will be plus 4.5 diopters. If my objective refraction value is minus 3, net objective refraction value is minus 3, and my working distance is 66 centimeter. So I'll add plus 1.5 diopters to my net objective value. So minus 3 plus 1.5. So the resultant will be minus 1.5 diopters. So that is what is the starting lens to start the fogging technique. Now, is it clear? Okay. Yeah. Now, what are the 5? So to make it very clear, so what I'll just tell you 5 steps in fogging. Don't even have to, it's not very much. Only thing what you have to keep it in mind is 2 tips, which I'll explain it later. Okay. Yeah, Ranjan, tell me what, anything? You raised your hand.
No, ma'am, by mistake.
Okay, sure, no problem. Yeah, so 5 steps which are in, I think still the hand is raised. Okay. Yeah, 5 steps, whatever are involved in the fogging technique is that first, like I said, fogging is a monocular technique. You have to occlude contralateral eye. If you are doing for the right eye, occlude the left eye. If you are doing for the left eye, occlude the right eye. Second step is add plus 1.5 diopter sphere to the objective refraction value. Okay, so whatever is your objective refraction value, whether it is a myopic error or it is a hyperopic error, add plus 1.5 diopters. Here I wrote plus 1.5 diopter because my working distance is 66 centimeters. And if your working distance is 50 centimeters, add plus 2 diopters to the net objective refraction value. Now, from the blur point, okay, reduce the plus power in 0.25 diopters. Reduce the plus power in 0.25 diopters or add more minus in 0.25 diopters. Okay, so whatever it is, you have to do it only in the 0.25 diopter steps. Okay, now the final spherical power should be the maximum plus or the minimum minus, which gives the maximum visual acuity. Okay, either you take a plus, it has to be maximum plus. When you take a minus, it has to be minimum minus, which gives the maximum visual acuity. That is what is the best vision sphere. The same procedure you have to repeat it for the contralateral eye. Is that clear now? Okay, I'll just explain you more. Okay, so like I said, few steps which are very important is that while you are changing the plus lenses during the fogging technique, what you have to keep it in mind is first place the second lens and then remove the first lens. Add the next plus lens and then remove the previous plus lens from the trial frame. For example, you started, we'll take a same example of this. So plus 3, right? You'll add plus 1.5. The starting lens will be 4.5. From 4.5, I have to slowly decrease the plus. So what I'll do is now, I'll keep first 4.5. I'll record the visual acuity. Next, I'll keep 4.25 in the trial frame, and then I'll remove plus 4.5 from the trial frame. Okay, always remember when you are changing the plus lenses, first place the second lens and then remove the first lens. The reason is that, again, not to stimulate your accommodation. Okay, so now what happens next? From 4.25, I'll place plus 4 and then I'll remove the plus 4.25. Then I'll place plus 3.75 and I'll remove the plus 4 lens. So that way you slowly, you will reduce the plus power in 0.25 diopters, and the final where you stop it is that where with the maximum plus power, where the patient is giving you the maximum visual acuity, that becomes your end point for the fogging technique. Okay, so exactly opposite is what we do it for the minus lenses. Okay, for the minus lenses, what happens is that first you remove the minus lens, first minus lens, and then place the second minus lens. So remove the previous minus lens and then add the next minus lens to the trial frame. Same, for example, if your net objective value was -3, my working distance is 66 centimeters. So my starting lens will be -1.5. So now from -1.5, I'll remove -1.5. I'll place -1. So 1. Then what I'll pen? I'll remove -1. So that first to remove the lens and then place the second lens. -1.5, right? I'll remove -1.5, then I'll place -1.75. Okay. And then I'll remove minus 1.75. I'll put minus 2. Then I'll remove minus 2 and then I'll place minus 2.25. So in that way, slowly change the minus value towards your net value and stop it where with the minimum minus. Okay, with the minimum minus where the patient gives you the maximum visual acuity. Okay, always remember the end point should be maximum plus or minimum minus, which gives the maximum visual acuity. That should be the end point for the fogging technique. Okay, and while you are placing the trial lenses, make sure that you don't block the visual axis of the patient. So in the process, while you are removing the lenses, don't block the visual acuity of the patient. And also the while you are obstructing the view of the patient may shift the fixation from far to near. That also changes the accommodation, and also it becomes difficulty for the patient to compare one lens against the other and to give you a response which is the best lens which is giving you the maximum visual acuity. Okay, so that also you have to keep it in mind when you are changing the lenses. 3 simple steps. Okay, when you are changing with the plus lenses, place the second plus lens and then remove the first plus lens. While you are changing the minus lenses, remove the first minus lens and then place the second minus lens. And while you are changing the lenses, don't block the visual axis of the patient. These 3 steps are very important while you are doing the fogging technique. Okay. And the end point of the fogging technique is, like I said, maximum plus power or the minimum minus power, which gives the optimum visual acuity. Okay. Always it has to be minimize the accommodation so that patient will have more comfort with the spectacles prescription. Okay. I just gave you an example over here. For example, if your net object to refraction is plus 4.5 diopters, your starting lens of fogging technique will be plus 6. Okay. With plus 6 lens, record the visual acuity. Now the second lens will be plus 5.5 diopters. Now what you have to do it is place 5.5 diopters in the trial frame and then remove the plus 6 lens. My third lens will be plus 5.25 diopters. So place 5.25 diopters in the trial frame and then remove the 5.5 diopters. And for every change in the visual lens, also make sure that just observe how is the visual acuity is being changed. The reason is that then only you can understand which is the lens which is giving you the best visual acuity. Okay. Same with the minus lenses also. For example, if my net object to refraction is minus 4.5, the starting lens for my fogging technique will be minus 3. So I'll place a minus 3 in the trial frame. I'll record the visual acuity of the patient. My next lens will be minus 3.25. I'll remove minus 3 and then I'll place 3.25. Then I'll remove minus 3.25 and then I'll place minus 3.5. So again, for every change in the lenses you make it, also please notice how is the visual acuity being changed. Whether it is a hyperopic correction or it is a myopic correction, please do perform the fogging technique, because so it's not only important for the hyperopic patients, even for the myopic also fogging is very important so that you don't end up in doing the overcorrection to the myopia. Okay, how is it important for the hyperopia? We don't end up in the undercorrection. Even for a myopic correction also, fogging technique is very important so that you don't end up in overcorrecting the myope. Either you overcorrect a myope or undercorrect a hyperope. Again, your end point, what you are having is the stimulating the accommodation, which the patient will not be comfortable with the final spectacles prescription. Is that clear? Shall we move to the next technique?
Yes,
Any
ma'am.
questions? Any questions in the fogging?
Yes, ma'am. No, sorry.
Okay. Yes. So if you have any questions, just you can write it in the chat box. Okay. Maybe at the end of the class, we can just take with the questions. Okay. So the next step, what we perform in the subjective refraction, once you got the best vision sphere, is the cylindrical component. When you have a spherocylindrical prescription, okay, first check the sphere, just get the best vision sphere, then you go ahead and refine the cylindrical axis and the power. Okay, so if you are very confident with your objective refraction values with the cylindrical power and axis, directly with the help of the Jackson's cross cylinder, you can refine the axis and the power. Okay, but if you are not sure with your objective refraction values, either it is the axis or the power, especially if you are not confident about the cylindrical axis, so what you can have it is that quickly what you can do it is you can use something called astigmatic fan test. Okay, so other name for the astigmatic fan, we also call it as a fan and block test. Hope you might have all seen this chart, right? How the astigmatic fan look like. It has got a different radial lines, different we call it as a spokes also. So where we have it from 0 to 180. Okay, 0 to 180, similar to what we have it in the trial frame. Okay, so now what you have to do it is, okay, with the best vision sphere in the trial frame, again, it is also a monocular technique. So while you occlude the other eye. So with the best vision sphere in the trial frame, what you have to ask the patient is, show them this fan and block test and ask the patient, okay, so of the radial lines, which is the radial line that is more clearer and sharper? Okay, which orientation of the lines? Okay, we have from 0 to 180, right? So which orientation of the lines are more clearer, and maybe you can ask clear, darker, brighter, and sharper. Okay, and the axis of the minus cylinder, will be perpendicular to the radial line that appears darker and brighter. For example, if the patient says the line which is 90-degree oriented is more darker, brighter, and sharper, then your axis of the minus cylinder will be 180. It just goes perpendicular. Okay. If the patient says the radial line which is showing you 120, okay, is more brighter, sharper, and clearer, then the axis of the minus cylinder will be perpendicular to that. That is, the axis will become as 30 degrees. So for 120, the perpendicular is 30 degrees, right? So always remember that. So the minus cylinder axis while you are using the astigmatic fan will be perpendicular to the radial line that appears darker, brighter, and clearer. Okay, so this you can roughly estimate, or you can correlate with the axis what you got it in your objective refraction value. Next, what you can go ahead and you do is you start doing the JCC procedure, okay, to refine the axis and the power. Okay, so how we'll start before you start refining the axis and the power, first thing which is important is that when do you have to introduce the cylindrical component? When you have a spherocylindrical prescription, so most of the times the difficulty would be, when do I have to start introducing the cylinder power? Okay, so always remember that while you are changing your spherical lenses, okay, if you notice that there is no improvement happening to the visual acuity, though you are changing your sphere lenses, then that gives us an indication that it's time to introduce our cylindrical component. Okay, while you keep on changing your spherical lenses, but still the patient is not able to improve the visual acuity or not comfortable with the change in the spherical lenses, that tells us that now it's time to introduce the cylindrical component. Okay, so I'm taking an example over here to discuss on the JCCs. For example, if you have a power of +3 diopters with -2.25 diopter cylinder, axis at 90. Okay, here the axis is 90, right? When you have shown the astigmatic fan, patient would have shown the radial lines which are 180 oriented will be darker and clearer.
More clear.
Yes. Okay. So now what I'll do for +3, first what I'll do a fogging technique. My starting lens will be +4.5 diopters, and then I'll slowly decrease it. Example, at +3.5 diopters, patient reported that at 3, there is no further improvement in the visual acuity. Then what I'll do, I'll introduce the cylinder. Okay. Even while introducing the cylinder also, make sure that you don't introduce the total component. If you have got in your objective refraction -2.25 diopter, doesn't mean that you give the total amount of cylinder as the prescription. Even the cylinder component should be introduced initially, half of it. So if it is -2 diopters, I introduce only -1. Slowly, I'll change -1 to -1.25, then 1.5. Slowly, I'll change in 0.25 diopters. I'll increase it in 0.25 diopters, and I'll see where I can get the maximum visual acuity. Okay. So once you get the cylinder component, then you start refining using the Joxon's cross cylinder. Okay. So you all might have seen the JCC, right? So what happens in the JCC is that you have got a two different orientation of the axis. One is the minus cylinder axis and other one is the plus cylinder axis. Okay. So, but the spherical equivalent of the Joxon's cross cylinder is what is the 0. So you have, when you talk about the plus or minus 0.25 diopters JCC or plus or minus 0.5 diopters JCC, the spherical equivalent remains 0. So at one orientation, you have plus 0.25 diopter cylinder, and the other orientation you have minus 0.25 diopter cylinder. Okay, so always the spherical equivalent remains 0. So while you are doing the JCC power, first you have to refine the axis, then you have to refine the power. Once you confirm the axis refinement, then only go ahead and start with the power refinement. Okay, and also make sure that, so when you are changing the orientation, okay, first thing what you have to make sure is, usually from manufacturer to manufacturer, from company to company, the all the JCCs may not have the same color, like what you say, color notations. Okay, so usually you have red and green, or you have black and white, or you have red and white. Okay, so you have colors to define which is the minus cylinder axis, which is the plus cylinder axis. But not every time your red color will not be minus cylinder axis and your green color will not be plus cylinder axis. First thing is, go check on the lensometer to know which is the plus cylinder axis and which is the minus cylinder axis. Okay, so because don't get carried out with the common what is that myth that red is minus and green is plus. Not necessary. From manufacturer to manufacturer, it varies. First confirm which is the minus cylinder axis, which is the plus cylinder axis. Okay, so you are here, an example here is that red is the minus cylinder axis. Here the example what I'm telling here is the red is the minus cylinder axis and green is the plus cylinder axis. Okay. Is it post-lunch effect? I can see people, MTC campus, some people are sleeping. No? Is GMRV campus there? Yes, okay. Okay. So I can understand the post-lunch effect, but people, if you are feeling sleepy, or if you want, just go out, wash your face, have some water, and then come and sit. Okay. Yeah. And the other thing you have to also keep it in mind is that always, like how you have got your retinoscope, how you have got your lensometer, when we talk about the Joxon's cross cylinder, we talk only about the axis meridian. We never talk about the power meridian. We only, the JCC also gives us the axis meridian. Okay, that also you have to keep it in mind. Okay, and what happens in the JCC is that with the help of the JCC, we can narrow down the Strum's conoid and we keep the circle of least confusion as close to the retina. Okay. In one position, what happens is that it broadens the Strum's conoid. In another position, it narrows down the Strum's conoid. It has to be the narrow Strum's conoid, and at the same time, the circle of least confusion should be close to the retina, on the retina, without even changing it. That should be the major purpose of the Joxon's cross cylinder. Okay. So here in my example, whatever I am showing you, red is what is the minus cylinder meridian and green is the plus cylinder meridian. Okay. Now what I have to do it is, so when first thing what I said is, first you have to refine the axis meridian, then you have to remind the power. First axis of the cylinder, next should be the power of the cylinder. What is the axis here? I gave an example, 90 degrees, right? My power is plus 3 diopters. Yes, my power is plus 3 diopters with minus 2 diopter cylinder, axis at 90. So when you are refining the axis of the cylinder, align the handle of the JCC to the axis. Here, for example, can you see the handle of the JCC is aligned to the 90 degrees. Okay, is it understood? For the axis refinement, align the handle of the JCC to the axis of your cylindrical power. My cylindrical power is 90 degrees. So I'm aligning my handle of the JCC to 90 degrees. So while I am aligning my axis at 90 degrees, what happens? My minus cylinder is my minus cylinder axis is 45 degrees apart from the original axis. At the same time, my plus cylinder axis is also at a 45 degrees apart from 90 degrees, right? Can you see here? So exactly from 95 degrees, you can see red is my minus cylinder axis, right? So red is less than 90 degrees and green is plus cylinder. Green is more than 90 degrees, but they both are 45 degrees apart. Okay, now you show them flip 1 position and flip 2 position. Ask them whether flip 1 is better or flip 2 is better. Imagine this is what is the flip 1 position. Now comes as the flip 2 position. What difference did you notice from flip 1 to flip 2? Can anyone tell me? Flip 1 to flip 2. Here 2 images you are seeing, right? So what is the difference you have noticed from flip 1 to flip 2?
In flip 1, the red is lesser than 90.
Yes,
And
very good.
green is more than 90.
Okay.
And the flip 2, it's vice versa. That means green one is lesser than 90 and red is more than 90.
Perfect. Is everyone clear with flip positions? Flip 1 and flip 2 positions. Is that clear? This is what is the important step to understand in the JCC, because it's not that flip 1, flip 2. You need to understand what is happening in one flip and what is happening in the other flip. Okay. Now, okay. So always you have to focus the minus cylinder axis of the JCC. Why only minus axis is that? Our cylinder is also in minus, right? Minus 2 point, actually it should be 2.25. I wrote it in the top wrong. Our is also minus cylinder, right? Our correction is also minus 2.25. So always when we usually do our refractions in the minus cylinder format, since our cylindrical powers are, since we correct the cylinders in minus format, so in the JCC also our focus should be always towards the minus cylinder axis. Okay. So in flip 1 position, our minus cylinder axis is less than 90. In flip 2 position, our minus cylinder axis is more than 90. Is that clear now, my statement? Is that clear with my statement?
Yes.
So if the patient says flip 1 position is better, what I'll do, I have to move my lens towards the minus cylinder axis in 5 degrees. What? Yes.
Ma'am, please repeat flip 1 and flip 2.
Okay, sure. Yeah. So, everyone got with JCC. First, you see this picture. In the JCC, you have red axis and the green axis, right? Red is the minus cylinder axis and green is the plus cylinder axis. Okay, always our reference point of the JCC should be minus cylinder axis. The reason why our reference will be minus cylinder axis is that since we correct the cylinders in the minus cylinder, we don't correct it in plus cylinders, right? If we would have corrected our cylinders in the plus format, then our reference will be plus cylinder. But always our spectacle prescriptions are corrected in only minus cylinders, right? So in JCC also, our reference axis will be minus cylinder. This statement is clear, everyone? Yes. Okay. Now what I'll do it is, over the minus 2.25, my power, what I got it is minus 2.25 diopter cylinder, axis at 90. Now what I'll place it, I'll place my JCC. Okay. So I'll just take my JCC. I think I have my JCC. Oh, God. 1 second. I think I should have my JCC. Yes. I'm visible to everyone, right?
Yes.
Yes, ma'am.
Okay. Yes. I don't know how clear you can see. Can you see red and green? No.
Yes, ma'am. It is correct, ma'am. Now we can.
You can see. So one there is a red and one there is a green. So my JCC will have red as minus cylinder axis and green as plus cylinder axis. Okay. Now, what was my, in the refraction I got? 2.25 diopter cylinder axis at 90, right? That is what is I got it. So 90. So axis at 90. I'll align the handle of the JCC at 90 degrees. You can see the same picture. I kept it over here. To the minus 2.5 diopters, axis at 90, I'll align the handle of the JCC. While I'm aligning the handle of the JCC this way, my minus cylinder axis is 45 degrees towards one side and my plus cylinder axis is 45 degrees to the other side. Okay. Since I told you take a reference of minus cylinder axis, in one position here, my minus cylinder axis is less than 90, right? In the first position, it is less than 90. In the second position, my minus cylinder axis is more than 90. Okay. Now I'll ask the patient whether plus first position is better or second position is better. If the patient reports that first position is better, where is my minus cylinder axis? Less than 90, right? My new axis will be 85 degrees. Because patient reported if first position is better, my minus cylinder is less than 90. So my new axis will become 85 degrees. If the patient reports position 2 is better, flip 2 is better, my new axis will be 95 degrees because my minus cylinder axis is more than 90 degrees. Is that clear now? If the patient prefers flip one position, okay, my new axis will be 85. If the patient prefers flip two position, my new axis will be 95. I'll move towards my minus cylinder. Minus cylinder where it is in the JCC. Okay, on the JCC in flip one position is less than 90. In flip two position is more than 90. Is that clear? Did I make this it clear?
Yes, ma'am.
Yes.
Yes, ma'am. Yes.
Example now, patient, here you see. Patient had told this position is better. Now tell me what is the new axis? Patient told this position is better.
85. 85.
Perfect.
85.
85. Because my always move only in 5 degrees. Don't move 10 degrees. Always move only in the 5 degree. So now what happens my new axis?
85.
85. Is that clear now? The power is 2.25. I wrote
Yes.
it wrong. It is plus 3 with minus 2.25. The axis at 85. Is the axis refinement is clear now? I
Yes,
kept the arrow now. Can you see a blue line there?
Yes, Shailaja.
Yes.
So I'll move towards my minus cylinder. So my new axis will become 85.
Ma'am,
Okay.
can you please repeat this again?
Your voice, can you just repeat your question again? I can't hear you clearly.
Ma'am, can you please repeat this again?
No, I told patient said this position is better. I asked a question. Patient said this is the position patient felt better. Now tell me which will be the new axis I asked. Where is the minus cylinder?
Less than 90.
Less than 90. Is it right? So my new axis will become 85
85.
because I move towards the minus cylinder of the JCC. Minus cylinder of the JCC is less than 90. So my new axis will become 85.
Yes.
Ma'am, actually, when you explained this to us, there was some problem in the video. So can you please explain this whole process again of JCC?
Which one do you want me to repeat? Which step you are asking?
That access requirement in JCC.
Okay. You want again the entire procedure you are saying? Okay, fine. No problem. So it is from MTC or GMRV? Okay. Yeah. So what I said is that two things you have to remember while you are doing the axis refinement. The first thing is where is the minus cylinder of your JCC? Okay. And the second thing is that which position patient has told you better. For example, in the position 1, okay, the original axis of the what you got it in your objective refraction is minus 2.25 diopter cylinder and the axis is at 90. So what I'll do, axis is 90. So I'll align the handle of the JCC also to 90 degrees. While I'm aligning this 90 degrees, what happened? My minus cylinder axis and the plus cylinder axis of the JCC will be 45 degrees apart. Okay, in one position, my minus cylinder axis will be less than 90 degrees. In the other position, my minus cylinder axis will be greater than 90 degrees. Same thing happens even if you do at 180 also. If I keep it like this, in one position, my minus cylinder axis will be more than 180. In one position, it is less than 180. That means 180 meaning 0 only, right? In one position, it will be 5 degrees. In the other position, it will be 175 degrees. If the patient says flip 1 is better here, where like here I told flip 1 is better, where is my minus cylinder axis? It is less than 90 degrees. So what happens now? The new axis will be 85 degrees. So you have to be very careful about which position the patient gives you the response as better. And in that response, you move your axis of your cylinder towards the minus cylinder axis of your JCC. Okay. Once you have done the axis refinement, so this you have to continue until the patient says there is no difference between both the flips. Okay. So once you established the axis refinement, the next step will be the power refinement. Okay. Once the first one is done, axis refinement is done, then with the power refinement. For the axis refinement, what have you done? You have aligned the handle of the JCC parallel to the axis of the cylinder, right? Now, for the power refinement, the axis of the JCC should be parallel to the axis of your cylindrical component. Now, for example, here in flip 1 position, the plus cylinder axis is parallel to 85. In flip 2 position, the minus cylinder axis is parallel to 85. Is it clear? Now the handle is not parallel. The axis of the JCCs are parallel. In the axis refinement, the handle was parallel. Now, not the handle, the axis were parallel. In one position, if you see here, flip one position, the green lines are aligned, right? To 85 degrees. The green lines are aligned to 85, right? That means the plus cylinder axis is aligned. In flip 2 position, the red lines are aligned. That means the minus cylinder axis is aligned. Ask the patient now whether flip 1 is better or flip 2 is better. If flip 1 is better, add plus 0.5 adapters to your cylinder value. That means how much will be your net value now? Plus 3 adapters with minus 1.75, because you have to add plus 0.5 to the 2.25. So the now the new cylinder will